Hello, this is Dr. David Green, CEO of the New Jersey Pain Network. Today's topic is what you need to know about acute and chronic back pain. Over 90% of Americans experience back pain at some point in life. And regardless of whether a person has treatment for that back pain, 90% of it gets better within 6 to 12 weeks. So an unfortunate few will end up with chronic back pain, and the definitions of acute back pain is 6 weeks or less, subacute is 6 to 12 weeks, and then chronic is when it occurs for over 3 months. It's the second most common reason for doctor visits, just behind the common cold. Half of all working Americans admit to having back pain each year. It's the most common cause of disability worldwide, and the direct and indirect cost of back pain annually exceeds $100 billion. So the causes of back pain, there are soft tissue causes and then there are hard tissue causes. The soft tissue most commonly is a back sprain or strain. Might be something from a weekend warrior activity or lifting, from moving, or it could just be a sneeze. It just could come on out of the blue. Here's a normal disc. So you have, it's almost like a jelly donut is the best analogy. You have the outer layer which is harder. That's called the annulus fibrosus. The inner gelatinous layer is called the nucleus pulposus. Okay? When you start to get degenerative disc disease, here's a healthy disc. You start to lose water and it gets compressed and it bulges kind of like a tire that's getting flat. Okay? So that's a cause of back pain from a soft tissue degeneration. A bulging disc or a torn disc or a disc herniation. Here on the right you can see what a torn disc looks like. Here's the annulus fibrosus, the gelatinous layer, the nucleus pulposus in the middle. Degenerative disc disease can lead to a tear in the disc, and that's called an annular tear because it's in the outer layer. That can be very painful. Okay, it can also spark up inflammation and cause pain down one of the nearby nerve roots, and that's called sciatica. Anyway, here's when you have a disc bulge, and it could easily be a tear, but anyway, normally it goes around like this. But here, this is torn and part of the disc has come out. Okay, so that's a disc herniation. It's pinching on this nerve root, inflaming it, and causing sciatica. Okay. Here's a cartoon of sciatica. Effectively, the sciatic nerve is a conglomeration of 3 nerve roots in the bottom of the lumbar spine. Okay, so it's not just one nerve root, it's a combination of 3. Now, what you have here, let's say it's a bulging disc that pinches on a nerve root. The symptoms that the person experiences are going to be consistent with which of these 3 nerve roots we're talking about. Okay, so the symptoms may be down the outside of the thigh, maybe down the back of the thigh and the calf, could be on the front of the foot. It all depends. Okay? Now we move into the bony causes of back pain. The first and most common is arthritis. Effectively what happens is arthritis in the spine starts in the disc, and as the disc degenerates, it pushes stresses to the back part of the spine where the facet joints are. So you start to get arthritis in the facet joints. Sacroiliac joint pain. There are 2 SI joints, and the name is because it's the sacrum and the ilium, so it's sacroiliac joint. Here you can see one on this side, there's another one over here, but they cause 12 to 25% of back pain, and basically they have cartilage just like other joints. They have slight movement, 2 to 4 millimeters every time we walk, and they are prone to arthritis and inflammation. Scoliosis in adults occurs from one of 2 phenomena. One is if you have scoliosis as an adolescent, it can continue to slowly get worse in adulthood and get pretty bad over decades. Or you can get scoliosis as an adult from degeneration of the disc and then the facet joints. And effectively what happens is arthritis often does not occur symmetrically. So you get more arthritis on one side as opposed to the other, and you end up getting a curve. Okay? That can cause back pain. It can also cause leg pain because you're typically pinching the nerves as they try to get out here. You see how these levels have less room here for the nerve roots to get out? Spondylolisthesis is when one vertebrae starts to slip on another. You see how there's some slippage here. Normally this is supposed to be back here. What it can do is it can cause back pain. It can also pull a nerve root forward. All right, here's where the nerve root gets out. It can pull it forward, and it can cause basically traction on that nerve root and lead to leg pain. All right. Spondylolysis is an interesting phenomenon where you have a stress fracture. You can get a stress fracture in your foot, stress fracture in your buttock region, stress fracture of your femoral neck and your hip. Well, you can also get a stress fracture of your spine, and that is called spondylolysis. It's very common to people who are involved in repetitive stress, gymnastics, football linemen, things like that, wrestling, where you're putting constant stress on this area, and that's what usually breaks. Typically, surgery is not necessary. You just have to let this heal by itself, or rest enough so that it just stops hurting. Spinal stenosis in and of itself is not truly a cause of back pain, but it's usually it's a byproduct of arthritis. So what happens is, in these joints, you get overgrowth of bone and soft tissue here and then here, and a disc degeneration can get hard and push back and pinch these nerves as they're trying to get out from the spine. Okay, so spinal stenosis often causes buttock and leg pain, but the arthritis itself can be a cause of back pain. For the uncommon causes of back pain, when you have an infection, you can have either what's called osteomyelitis, which is in the bone, or discitis, which is an infection in the disc. Fracture is most commonly a vertebral compression fracture due to osteoporosis. That's not so uncommon. There's about 1 million of those that occur in the U.S. each year. And then tumor. Tumor is obviously pretty uncommon, but multiple myeloma can occur in the spine. But most commonly what you get is a tumor that occurs somewhere else, such as lung cancer, and then you get a metastasis into the spine. The top non-operative pain management in New Jersey is through the New Jersey Pain Network. There are several clinics throughout the state with board-certified, award-winning doctors who are very good at working up and helping diagnose exactly where your back pain is coming from. Over 50 insurances are accepted, and over 25 treatment options are available. Visit us on the web at newjerseypainnetwork.com, and then call us for more information and scheduling at 844-2NJ-PAIN. I'm Dr. David Green with the New Jersey Pain Network. Your pain stops here.